I'm Grace from Daffodils Child Development Center, Hyderabad. Today we are launching a new series on question and answer. Every week we will be choosing one question from the comment box and Dr. Joshna ma'am will be explaining all the questions. We hope this interaction session will be helpful to many of you with similar questions. Let's start our Q&A series with an interesting topic of use of medications in children with virtual autism. Let me read out the question. Doctor, my 4-year-old child was addicted to mobile phone at age about 6 months. Now his age is 4. He had some autism-like symptoms like spinning the wheels, toe walking, echolalia, not responding to name, lack of eye contact. We showed him to a psychiatrist and he said that my child has high-functioning autism. But after we stopped all the screen time from the day we showed to the psychiatrist, the child's autism-like symptoms are gone within 2 weeks and language skill improving day by day. Eye contact is much better as a normal child. Doctor, can it be virtual autism? Our psychiatrist gave clonidine tablet to give to the child. If it is virtual autism, taking the tablet is harmful to the child. We showed him to the psychiatrist 2 months ago. Ma'am, can you please put your inputs?
Thank you, Grace, for coming up with such a nice question. And I thank the parent who has posted that question in our comment box. In a regular clinical practice, we have seen many parents who visit one of the medical doctor, and that's a mandatory protocol to be done before diagnosing the child and before treating the child. And usually we see the prescription of some sort of medications to the children. Specifically in your case, I'm happy that just with the removal of the screens, we have seen a lot of changes in your child's development. It could be even in terms of reduction in the autistic-like symptoms. So probably your child might have been into the category of mild high-functioning autism, as been rightly quoted by your psychiatrist. As you had a doubt in your brain regarding virtual autism, even I think he might come under that. But I'm not so happy with the spinning movements or with the repetitive movements and the other signs that you have mentioned in your question. But one thing which we all need to be vigilant is you need to remove the screens completely and continue the additional language stimulation which you are providing him. Improve his social communication also. Take him to a lot of social gatherings because autism, whether it's a virtual autism or it's a typical autistic spectrum, would affect the social life of the child. We call it as social communication disorders. And the last part of the question, when it comes to the use of medication, I would say you need to take a right guidance from your psychiatrist only. And I'm not the right person to comment on this, but as per my knowledge, I would say if the child is if the child is showing more improvements with the therapies or with the additional stimulation that you are providing, try to enhance more of the interventions and try to reduce the dosage of medication and take the medications only if the severities are too high and if it's going beyond the control, and always seeking the advice of a medical practitioner like a psychiatrist or a neurologist to handle such severe cases. Thank you so much. I hope you got my point on the use of medication in children with virtual autism.
Thank you, ma'am. Thank you all for being very interactive and encouraging us in answering all your questions. Please do like, share, subscribe and comment to our YouTube channel. Thank you.